Hi everybody, it's lovely to be here. My name is Monica Lalanda. I'm going to talk for the first few minutes, just keeping my camera on for this first slide so that you can put a face to my voice. I am a doctor, a mother, I am a bioethicist and a comic artist. I am the founder and coordinator of the Spanish graphic medicine movement. What we do is we aim to promote the use of comics as tools of communications in the healthcare environment. We have a website where we review a weekly comic, and we do various activities, very active in social media. We've run 2 national conferences, and we are currently running the first master's degree in graphic medicine at the International University of Andalusia. This is my book. This is a very special comic. It's the Spanish medical ethics code for doctors turned into a comic. It's become very popular in its 3rd edition. I've been co-author in the anthology Menopause, edited by MK and translated. Ian Williams, A Bad Doctor. I draw cartoons for 2 medical journals, one weekly, one monthly, and I am involved in various projects regarding communication, ethics, and comics. So during the pandemia, I drew a lot. In fact, I've only realized how much I've drawn when I was preparing for this little presentation. I've done several hundred drawings regarding the pandemia in one or other way. So I've brought a few for you, and I've sort of classified them in the main areas where I've been working on. One would be information for patients. Another one would be information for colleagues, healthcare professionals. I've done patient advocacy. I've done activism. I don't know whether to call it political activism or more of a medical social activism rather. And I've done some drawing for fun as well. This first one is about symptoms of COVID, and I had to update it a couple of times as our knowledge about the virus and the symptoms kept growing. I did quite a bit as well about advice on what to do in terms of what to do, for example, in this one, what to do if you suspect that you are infected. Because the first weeks, we've already forgotten quite quickly, but the first weeks were so chaotic, the information was so confused. So what I used to do was get hold of as many protocols as I could find and put together ideas that I thought were sort of made more sense and were more easy to follow, and then create these sort of infographics. I used to get ideas on what was causing distress to people from Twitter mainly, and I found myself stressed going to do the weekly shopping. So I did some research to get ideas on what would make people feel safer. And I think as well that at this point we all felt safer by knowing what to do. So good information became such a huge part of surviving these first weeks. And it was such a nice feeling to know that I was in a way helping society from the weird angle of drawing comics and using them in social media, and noticing how they just sort of move really, really quickly. There was a point where we were told that face masks were not necessary, but it was only because they were not available, because there were only masks available for healthcare professionals. But there was enough evidence, scientific evidence, to understand that we had to wear masks. So I came up with these infographics with information about material that was good enough for a homemade face mask. This is much later. This is already when we knew that keeping the air clean and having your windows open was a good thing to do, or not shouting. So it's funny to look at my own drawing to notice how the advice has moved. This was a really interesting document published by the European Centre for Disease and Prevention, where they came up with all the data of what was like for children infection, and whether they got infected and how did they get affected, and what has happened around Europe, the way that in the different ways they've managed schools, for example. And I thought it would be a good idea to turn this very complicated, complex document, a long document, into something easy to read, particularly for teachers who were very stressed at this time. Here are a couple of games I came up with to encourage people to use the face mask in a safe way. In fact, I did a video with the one in the left. This was done for people, specifically for people with developmental delay, by an organization of people who care for them. Asked me to do some very easy to understand advice on how to protect yourself. It's funny because it has been so long. It has been a full year, so we've seen all the seasons go by. So I did some stuff specifically for Christmas, like Christmas it's got to be inside this year, or remember that even if somebody is close to you and you love somebody, it doesn't mean that you are protected from the virus if they have it. This is a pretty late one about the importance of having a well-fitted mask, and I just got the idea from an article by the CDC. What I tend to do is give credit, sometimes just by using a QR code, a mention and then a QR code. I will take you to the full article. Or this one as well, where I start just making it very clear that cleaning all day and clean surfaces and hand cleaning doesn't really help that much, but it's much more important, for example, to measure the CO2, keep distances on, and definitely keep good ventilation and good fitting of your mask. All drawn in a very simple way with some attractive writing. This was a report about data, quite a lot of data from over 15,000 patients that were inpatients in Spanish hospitals, and what were their characteristics. So what was the patient at risk, which I thought was definitely would be really helpful for my colleagues to see this at one single glance, rather than using time that they don't have for reading a very long document. This one was advice for my colleagues, advice specifically for healthcare professionals, and this was a petition from somebody through Twitter who said, "Oh, I'm really concerned because people are not behaving in the sitting rooms, in the staff rooms, and I think we become too relaxed." So they just give me a few ideas, and I added a few more, and then I just came up with this one on things like, I don't know, be careful with stuff that everybody's touching. Imagine this is completely outdated now because it doesn't really matter, it's airborne, but about wearing the mask properly or not wearing a white coat and keeping distance and all this. This one, advocacy for the healthcare professionals. What I used here was an article that was published in the JAMA that was called Understanding and Addressing Sources of Anxiety Among Healthcare Providers, where they sort of addressed the stuff that they needed but wasn't being provided, and they were asking to be listened, to be protected, to be prepared, to be helped and to be cared for, and none of them was happening. Then my activism was to to make a vindication of unsafe working conditions that colleagues were working under and all this unmet demand. So I did quite a lot of drawing on this aspect, claiming that healthcare professionals were really suffering, distressed, separated from the families and unprotected, wearing just rubbish bags for the first few weeks and carrying all the weight of a terrible situation. I made a comparison of sending a fireman to fight the fire with a water can, or being thrown from a helicopter or a plane just with some balloons, or being sent to war with like that. And it was as horrible and against the law to send healthcare workers to work completely unprotected in the chaos that should have been thought of by the healthcare responsible. I did quite a lot on this area of going from heroes to villains of this story. I have drawn to honor the doctors who died during the pandemic. The numbers kept growing, and my drawings kept growing as well. Nowadays there's 110 of them that have died. Same thing here. This one obviously is quite a visual metaphor for the way the government has been treating the healthcare professionals. Remember, in Spain we have a social system. We don't have we have a little bit of private medicine, but we have an incredibly good system where everything is free from beginning to end for everybody. But unfortunately, that allows the system to take advantage of professionals all the time. There was a change in the law, so any doctor could be placed anywhere, independently of their specialty or place of work. So I sort of drew this in terms of we become soldiers, and the hen of the gold eggs was squashed and squished to death. Then advocacy for patients. Patients even today are dying alone. The situation continues to be terrible in the nursing homes, but at the same time we have had voting, we have had elections to local governments, and people were allowed to go and vote with no care in the world, but they couldn't go and stay with the mum who was dying. So the whole thing has become completely senseless. So I decided to be quite strong on drawing that with very strong visual images of it. There was a document by Médecins Frontières about the situation of the elderly in nursing homes, and how I think there's about 36,000 elderlies who've died in nursing homes, and apparently the chaos within was terrible. And this document, I thought, deserved to be seen and looked and viewed by people who wouldn't read a long document. Nursing homes who have closed doors since a year later. There are some people who have still not been able to get visitors, and I think nothing could be more sad than that when you are at the end of your life. To me, these people were the real heroes of the pandemic, all these elderly people. I've drawn several cartoons criticizing the political management of the pandemia, like this empty list of experts. They kept talking about experts, but we never knew who they were. Or this is the health minister who decided to go into local politics in the middle of the pandemia, or all politics fighting each other, boxing against each other, and as the citizens were suffering and the healthcare professionals were fighting, or they were opening hospitals but without staff, just beautiful and bright hospitals so I decided to add these wanted doctors to these lovely new beds. And in the middle, just a very confused citizens who do not understand what on earth is going on. This was probably one of the strongest visual metaphors with the idea of doctors like soldiers being sent to the battlefield naked and just with a slingshot. About the vaccine, it started with you are your own vaccine, you need to protect yourself, to then the different pharmaceutical companies just offering in a very weird way, as in a sort of on a form of competition, which vaccine was more useful and which one had more efficacy or effectiveness, sorry. And then the vaccination itself, and the vaccines are arriving a bit too slow to Spain, so I just sort of made this cartoon saying that the vaccination might end up in 2031, and then people who shouldn't be getting the vaccine are jumping the queue and getting vaccinated before the elderly or the healthcare professional or the ill. And that's it. Thanks very much for having me, and enjoy the rest of the meeting.